So still we have the issues with, I know I have hear about this 90 targets and things. So
Yes, yes.
we had stigma is the key for every achievement we have things. So the main block is that stigma reduction is the things we have. So from a policy and ethical standpoint, what practical steps should Sri Lanka prioritize to eliminate is discrimination, not the HIV, discrimination to be eliminated first. So, especially among the health institutions, even among doctors, when I teach the students, medical students, I usually ask, what's the difference between a diabetic patient with control and HIV patient on treatment? Do you see any differences? No, I think nothing.
Exactly. I think our undergraduate education also, of course, I have not been in touch with undergraduate education for quite a bit of time. I think that is also a place where there should be some more behavioral sensitivities, you know. Anybody coming with HIV or anybody with gender diversities, they should not be, you know, discriminated.
To any extent they can't do this discrimination.
That is where I think the law has to come up, you know. So any misconduct from the health sector, because we all join the health sector to do a job of work, right? So, and there are some ethics which you need to practice. So people, if they forget that, I think the laws also have to be strengthened where the health sector stigma and discrimination is concerned. Everybody has to be treated alike, and if you don't want to be treated differently, so is the other person. So those things are gradually, I don't know whether I'm right in saying it, but I'm seeing, you know, a lot of those ethical values are declining in Sri Lanka, unfortunately. I don't know whether you agree with me, but unfortunately we are seeing that.
That deterioration is there. I think for this, already we have discussed this. There are organizations such as the AIDS Foundation, and you were chairman for that earlier. That things. So that's play a crucial role for this civil societies and community partnerships. Can you describe that activities, madam?
Yes, actually the AIDS Foundation Lanka was established just after this AIDS conference that was held in 2007, and it was Professor Sharif Dean, Mr. Bradman Birakun and myself, we were the co-chairs. So we established this exclusively for the benefit of the people living with HIV, so that they don't have, you know, like especially economic and other social needs, so that they can come up for some help. And also we
still the aids are continuing, that helps are given to the
still we are giving like every month we are giving a nutrition package, and we are also supporting when they want to get some tests done which are not available in the public sector, and also we are supporting the children, you know, infected and affected by giving their, you know, today you all majority 99% want tuition, and that's not given free. So even I think rich people or the middle class or whoever also find it difficult to meet that demand. So we try to help them, you know, and we make it a genuine case. And our clients are actually people referred from the STD clinics. So one objective is that they are connected to the STD clinics for adherence of treatment also. So when they come to the clinic, the doctors there, when they realize that they need some socio-economic support, they are sent to us. So we provide their tuition fees, then the transport facilities, then some people suddenly they want a computer, you know. So not that we can give computers to all HIV infected children, but we make it a case by case, study it well and see that it's a genuine case, you know, not people trying to hoodwink us.
Tell me, madam, how are you approaching? You are approaching methods for this key population. All are the hidden population usually in Sri Lanka. So how, what mechanisms you use in the HIV/AIDS campaign to approach these people?
Yes, now actually with the Global Fund is still supporting the HIV prevention in Sri Lanka. In Colombo and Gampaha, they have a case finding model where they have trained people and they go looking for cases, and then and there they can do the RDT, the rapid diagnostic test, or refer to the close by STD clinic so that they can get tested. And together with that, they are given a package, of awareness, then pre-exposure prophylaxis, which is currently is a recommendation by the WHO, and that's a risk assessment done and given this pre-exposure prophylaxis, and condoms and lubricants, all that they are linked to the STD services. But I must say that there is a small group, even if they are linked, they default, and that's the nature of people. I think not only because they are HIV positive, but people, by nature, I don't know whether it is because it's given free, but there is a component, a small percentage who default also treatment.
How do you approach the beach boys?
There are now, particularly in areas like Matara, Gaul, Hambantota, coastal belt, there are these community organizations. So they are being given this opportunity to reach out to them. Assessment is done to look at their strengths. If the organization is capable, then the Global Fund provide them with a service package, and that's HIV testing facilities, awareness, pre-exposure prophylaxis. So they are given economic support as well, and they reach out to, through peer educators, reach out to these beach boys and educate them, get them for testing. But I think among the beach boys, the HIV prevalence has been extremely low, but they are being made to understand, because most of the beach boys, they are not men who have sex with men, right? But they have sometimes bisexual behaviors, and also they get into like sex activities with foreigners, things like that. So they are being given this package for prevention. But if I remember right, since of late, maybe the last 3-4 years, there were no HIV positives among them.
Okay. Madam, the surveillance we have, but HIV or any sexual transmitted infections are not a notifiable disease officially. It's not under that list. We are doing it separately. So can you describe that mechanism you adapted for the surveillance part, Madam?
Yeah, as you know, the surveillance system, the screening is done for what? So that there's a treatment available. So now that there is treatment available, the surveillance system is able to capture, right? So especially among our STD services, if you look at the clinical settings, everybody who comes to the STD clinic are screened for syphilis, for gonorrhea, for chlamydia, for HIV, Hep B, Hep C. So that system is going on. And also there is a behavioral surveillance going on, and this grand behavioral surveillance strategies are done like every 5 years. There is a survey that is planned. I think the last was in 2018, and currently I think in 2026 there will be a behavioral surveillance where in about 6 districts they will be the key populations will be taken for a survey, and also at the same time there will be a biological surveillance as well. So it will look at their risks, their condom use, their testing facilities, all that. So those
snowball sampling you are going to
yes, that's this rapid what is this? It's called the rapid diagnosis. No, not RDT. It's a RDS method. It's something like the snowball. Yeah.
Okay. Madam, so to make public awareness the media contributions are very, very important for us, I think. So modern media and also the digital media nowadays and social medias we have. So how can Sri Lanka strategically leverage these digital health communication tools to improve STI and HIV literacy while ensuring accuracy, confidentiality, and youth engagement? So you can tell us previously how you use this mass media for HIV control and how we can move forward.
Yeah, previously there was a good contribution by the print and the mass media, and gradually I think these social media platforms have overtaken the print, and they also have taken a back seat, if I'm not mistaken, for these health related activities. But I think this social media is not correctly tapped so far.
Yes.
There should be there is a communication strategy developed by the National STDs Control Program, but that has to be launched in collaboration and in a way that the messages can be conveyed, people accept it. So I think those platforms are not really exploited to the level that it should be. So that area is rather weak. So that is an area where somebody has to really sit down and make a good decision.
Yeah, so that media part, I think, even I don't know, developing the message and approaching the different continuous messages.
Continuous, yes, that's right.
Things, I think, I don't know, the Ministry of Health, I think at the moment how much they are concentrating for this new models, the TikToks and their Instagrams and things are there. They are the key.
There is a program, platform called Know For Sure by the at the NSACP. That's also funded by the Global Fund. But I don't know whether the real difficult to reach people.
Yeah, for this kind of group.
Yes, that's the thing. So it is, especially these MSM groups have various other social media platforms. So I think it's a good thing to go into those, I'm not a great expert in this communication channeling and all that, but I think the people who can give the correct advice, actually young people will be good enough to give how do we get information, all these chat rooms and whatever. If you look at teenage pregnancies, invariably it's they don't even know each other.
Yeah, this is by the time Facebook and the chat books are there.
Yes, exactly. I think those are the places that has to be tapped.
Okay. So sustaining this low prevalence, I don't know how much it in future, because already you are also worrying about the social media and people involvement. So what policy safeguards, monitoring mechanisms?
Yeah, I think the current policies are okay, and those are all based on evidence and all that. But I think the laws related to some of these, misconducts and violence and rape and all that, I think there is still quite a few loopholes. So those should be strengthened. And even like teenage pregnancies. Now teenage pregnancy is an area where any community will understand, because it's somebody's daughter, somebody's sister who is being affected.
Straightforward,
That based on that, I think the social platforms should be exploited. That's a very difficult area where this youth involvement, but I think these youth clubs and other organizations like Girl Guides, Scouts, those are now, we from the AIDS Foundation, we have had several programs for Scouts in Kurunegala. There is a Scout, some organization there, then the headquarters. But the only thing is, these are also not very sustainable.
That's something I was asked. Yeah, we are starting the programs. How we can make
exactly this is the thing. I told you, with the change of the officials, things get diluted.
Okay, so integrating HIV prevention into broader healthy equity agenda. Something everywhere we have to make it with our primary care concepts and things. So how can HIV and STD prevention be more effectively integrated into Sri Lanka's broader public health development policies?
Yeah, I think maybe about 10 years ago there was this slogan, one health, one strategy, something, you know. I can remember one something, you know. So even the NCDs, they tried to, there was a recommendation. Now, for example, when in the workplace, NCDs are being addressed in the workplace.
Yeah.
So that's a platform to go into STD.
STD, yes.
Right? So those are, I think, have to
we
be
incorporate something for maternal and child health with STD and things.
Yeah.
But other programs I don't know
exactly. That's the thing. So it's being kind of played down. So those are the things that you know, with the changes in society now in CDs, for example, they started it very well with this primary health care model. Then gradually they'll say no test kits, no this, no that, right?
Academic crisis.
Yes. So at least in us, in some model areas, you know, you have to look at some districts and their prevalence, the community strengths, the strength of the health services, and maybe select a few and go into that.
In case, I think this main funder for this HIV/AIDS control in Sri Lanka is a GF is the one, ATM, Global Fund. Nowadays we call Global Fund. In case in political global scenarios, if it stopped, what will happen for the programs we have here?
Yeah, it's a difficult question to answer, right? So there is a thing called a transition. So this transition started 3-4 years ago when Sri Lanka actually was coming out of this economic crisis. The Global Fund also decided they'll like have 50-50 sharing, for example, say for antiretroviral therapy, 1 year 50-50. Then Sri Lanka 70, Global Fund will put 30, like that, you know, on a scale like that. But then again with these cyclones and all that, there are several other priorities for Sri Lanka. So I think the Global Fund probably, actually the last year will be 2028. No, 2028 for Sri Lanka.
So we have to take it over.
Yes, so 2027 and 25, 26, 27 are the 3 years, and 28 will be like a transition year. But I think the government probably will be looking at negotiating with them, and so that we sustain it a little more and take it entirely to the government hand. So at the moment it's a bit dicey for me also to comment, because there are the goods and the bads, you know, but nevertheless Global Fund wants Sri Lanka to, any country, to be locally funded, but let's see whether the governments can negotiate.
Okay, thank you so much, madam, for your, hopefully you also answered all the written answers, I think.
Yes,
so
thank you
so much for
your
valuable time and your experience. I think definitely it will help the future generations, especially the ground level public health workers and other people who are working in this public health sector, to make Sri Lanka a public health excellence always, I think. So definitely it will be helpful. Thank you so much.
Yes, thank you. I'm very happy that this is after a long time that I'm also talking like this. So this is the kind of thing we have to have continuously, and keep this in the health agenda.
Yes,
so thank you for coming.
We are trying to make it a video clips and telecast. In the meantime, we are trying to question answer based booklet, something is there to publish also, to document it.
Okay.
Definitely we'll send it to you and make it correct, and later we can do it also, I think. So thank you, madam.
Thank you.